Hi, I'm Cat Navarro Lee with the B Foundation for Brain Aneurysm Prevention, and I am here with neurosurgeon Dr. Anthony Wong and Erin Kreszl, who's the co-founder of the B Foundation. And I just wanted to say I am an awareness ambassador and brain aneurysm survivor who loves telling stories that help empower and educate people about brain aneurysms. So here we are, and I will hand it off to Erin.
Hi, everybody. As Kat mentioned, I'm Erin Kreszl, co-founder, along with my sister, Christine Condra, and executive director of the B Foundation for Brain Aneurysm Prevention. As Kat mentioned, we're a brain aneurysm prevention organization, and we fund research, raise awareness, support all those who have been affected by brain aneurysms, and then we also work hard on Capitol Hill to push forward advocacy efforts for brain aneurysm. So really excited to be here with Dr. Wong from UCLA. Interesting tidbit, actually, our first grant 11 years ago was with Dr. Chi Chien at UCLA. So we're excited to come back around and do work again with UCLA. And so, we're excited to learn more, Dr. Wong, about your efforts. And then also what has been the impetus for this conversation is we recently did an interview with Neha Pai, who is a brain aneurysm survivor and was a patient of Dr. Wong's. And we're doing an event at Cornerstone outside Philadelphia in Wayne, Pennsylvania. And all of the efforts from this wine dinner that we are doing is all in support of a UCLA fund that will go on to help patients of Dr. Wong's as well as others at UCLA. And importantly, it will hopefully also impact the lives of those who have been affected by the devastating fires and are also battling a brain aneurysm disease. With that backdrop, I'll turn it back to you, Kat.
Great. So thank you again, Dr. Wong, for being here.
It's a pleasure.
And we're so excited to talk to you. We're familiar with you. We recently talked to Nihai and we know that we could learn so much from you. So as we get started, I just wanted to ask you why you got into neurosurgery and particularly treating the pediatric population.
Yeah, so thank you for having me. It's great. It's great to see you, Kat, doing so well. And first, I just wanted to say how much I appreciate you, Erin, and all that the B Foundation is doing, to provide support for improving treatment of these vascular conditions like aneurysms. I got into neurosurgery partially just because it seemed like a really good fit for the things that I was good at and the things that I was interested in. I've always liked tinkering with things. I've always been good with my hands. And so it became pretty clear when I got into medical school that a surgical subspecialty was the way to go. It's actually a big coincidence, but right around that time is when aneurysm coils were first invented. This is a very common technology today used to treat hundreds of thousands of patients minimally invasively, but before the advent of this technology, which really kind of bolstered the development of the field of endovascular neurosurgery, the treatment of aneurysms through the inside of vessels. All aneurysms are treated by surgery through a craniotomy, which is an opening in the skull, and looking at the aneurysm from the outside and fixing it from the outside. I remember when this technology first came out and the first patients were treated and how big of a deal it was, how big of a sea change it was in this field that I was already starting to get interested in. And, fast forward 15 years, 17 years, the guys who invented this technology were here at UCLA, and I get to call them partners now. So, one of the reasons I got into neurosurgery was it was clear that this was a field where there was a lot of room to improve the care that we provide for patients, for the outcomes that can be expected for patients with some of these diseases. And so it seemed like a really interesting field to delve into, and where I might be able to make a difference to help some people. And it really was as simple as that. When I started doing neurosurgery residency, it became clear to me that I was one of those people who really took a great deal of joy in helping kids. I had never been good with kids. Kids still don't really like me, but I really enjoyed taking care of kids, and I enjoyed taking care of the whole family. I knew I wanted to make pediatric care part of my practice. And so I've been lucky coming here to UCLA, where I've been able to meld practice where I do a lot of complex vascular surgery with a practice where I also am able to include pediatric care. So I take care of patients with all sorts of vascular conditions, including aneurysms, throughout the spectrum of age.
So what do you think are the main differences when you are treating an adult versus a child?
In medicine, we frequently have to teach trainees that children are not just small adults. In some ways, adults are kind of obsolete children in that the diseases that we care for, in particular, aneurysms, these are oftentimes, when we see them in adults, diseases that result from wear and tear on the inside of blood vessels, right? Not always the case, but the most frequent kind of contributing factors that go into developing aneurysms are stuff like smoking and high cholesterol and that sort of stuff. In children, that's just not the case. With children, there are oftentimes developmental, issues that lead to the development of these aneurysms. They sometimes have just kind of inborn susceptibilities to developing aneurysms. And so the aneurysms they develop are oftentimes extremely complex, much more difficult to kind of plan treatment for than the kind of very typical aneurysms that we see in adults. It requires a really, really strong team of specialists from all sorts of different disciplines in order to really even understand these cases kind of inside and out, and to really understand what all the options are, all the technologies and all the techniques that we can bring to bear in the treatment of these aneurysms, and then to kind of choose among them, right? Because they're not that common. So in order to understand kind of decision making, understand how to inform and guide families, we also have to do a lot of reading, calling up colleagues all over the world. Each of these cases tends to be pretty unique. It's a real privilege to get to work with a bunch of people who are real experts in their field, and we can kind of get together and come up with sometimes very creative solutions in order to help these patients. Each of these pediatric cases tends to be quite a challenge. Being able to put a kid back on the playground or, back in school and give them their whole future back is really exciting, is really rewarding.
Yes, definitely. Is there normally a genetic component when it comes to aneurysms? So with kids, would it be beneficial for somebody with a history of aneurysms? Like for myself, I worry about my kids and wonder, do I need to get them scanned? And is that something that you see regularly and recommend?
Yeah, so our understanding of the genetic contributions to aneurysms is only just beginning. Erin, you mentioned A.G. Chen. I actually work quite a bit with her on exactly that question, in understanding the genetic and then kind of the next layer of gene regulation, epigenetic contributions to the development of aneurysm. As we understand the disease today, hopefully this will change, but as we understand it today, there are certain genetic susceptibilities that are generally not ones that are passed on in a heritable fashion, right? Not passed within a family, but there do appear to be some genetic susceptibilities to developing aneurysms. Much more importantly, however, are those same kind of risk factors for development for blood vessel injury, stuff like smoking and high blood pressure, high cholesterol. Those are the far more important risk factors, but our current understanding is only really just beginning to kind of get into the where the genetic contributions to aneurysm development lie.
Would you recommend, as somebody who's a brain aneurysm survivor, taking proactive measures in terms of, is there a certain age when I should, get my kids scanned, or for other people who have a family history?
Yeah, so that's a great question. And the way that I counsel patients is that if there is two or more family members, first degree family members that have aneurysms, we'll generally recommend screening imaging for another family member. Now, that's something that we don't expect to find anything, right? It's not so common that we expect to find aneurysms in those patients. But when patients come to me with no real family history of aneurysms, or maybe like I had a cousin or an aunt that mentioned that they had a brain bleed. When patients describe that, I generally don't recommend screening imaging for them or their children.
Kind of on that note, just curious, are there any signs that you would look at or that you have found in your practice that are different than adult warning signs of aneurysms? Do you find anything different with children, or are there more incidental findings when you're looking into other areas that you find these malformations in children?
In children, I mean, really in anybody, nobody expects to find that aneurysm. And for the most part, aneurysms don't tend to cause symptoms until they either rupture, meaning they bleed, or if they grow so big that they press on things. Now, in adults, it's pretty rare that they grow so big that they press on things. In children, it's much more common that we discover an aneurysm because it's gotten to the size where it's pressing on something. The majority of children that I see that have found an aneurysm, it's because of that. By virtue of having grown as big enough to cause symptoms like that, then they become, a much bigger challenge to treat.
Right. Yeah, it is always so devastating when you hear the stories of, children who've had a really bad aneurysm and, the complications from that. Thank you so much for talking to us about that. It's encouraging to just have some insight on, the hope for the future and just how much has already progressed from when you first started in this field.
Yeah, absolutely. I just amazed at how quickly the technology is moving forward and what treatment modalities are available to patients today that weren't available even, when I first got started.
Yeah, kind of on that note, Dr. Wong, when we started the foundation 11 years ago, about 15 years ago is where I think you mentioned where things were really starting to change. And I think that is one thing that caught Christina and I. There seemed like there was so much room for improvement in terms of awareness and education, and just that question out there of, can we prevent aneurysms from rupturing? And I know that's a big question. There's a lot of discussion about it and controversy, but you talk about your work that you're doing with Dr. Chien, and I know, 11 years ago, she was so excited that there was more foundations in the area and to really open up this field of epigenetics. The types of research that we're seeing now versus 5, 6 years ago is just incredibly different and exciting. So thank you for everything you're doing. And then I did want to ask, just for the community of viewers that will be listening to this, so what does it mean to have some additional support for your patients? You mentioned treating the whole family, and our experience in working with families, we know so much goes into supporting the family, supporting the patient when they leave the hospital. And obviously, we're hoping that we can provide some more aftercare and some support for families that have been affected. And so I'd just love to hear from you what it means to have a fund that's really specifically for brain aneurysm families.
There's such a wide range of aneurysm patients, right? In the best of cases, there are patients who their aneurysms are found and we're able to take care of it early. And for those patients, we work really hard to make our treatments as minimally invasive as possible, right? Whether those are endovascular treatments or whether those are open surgical techniques. One of the things that I work on is developing minimally invasive surgical techniques for aneurysms, ones where patients leave the hospital the next day or, even same day. Then there's the patients who come in with, an aneurysm that's ruptured or a really, really high risk aneurysm of some kind, right? And those patients, their road to recovery may be many, many months, even years long. So those patients need, a vastly different resource pool for support. Like neurorehabilitation is extremely rare and hard to get at in this country. Even having specialists who understand kind of the particular difficulties that come along with recovering from these things tend to be a little bit different, but there's a close corollary to stroke. Right. So being able to support a patient that has both cognitive and motor problems is something very different than most physical therapy and occupational therapy. Neurorehabilitation is a rare kind of perk that we have access to here, the specialists that we have access to here, but not everybody does. And then finally, of course, there's that question of diagnosis, early diagnosis and understanding which ones we should leave alone and which ones are at higher risk. Right? That risk stratification is right now is probably kind of like the golden goose in our field where we are technologically. And that's something that, Dr. Chen and I are working very hard at. It's something that I know there's a lot of really strong researchers across the country that are trying to better understand, which patients need surgery and which ones are better, left alone.
Oh, great. Thank you so much for kind of walking through all those different nuances of your patient pool and broadly at UCLA. So just want to thank you again and thank you for your time. Obviously, we're getting really excited for the Cornerstone winter wine dinner that we're having this Saturday. The people that will be joining us for the event are so supportive, and we know their contribution will just make a huge impact on brain aneurysm prevention in general, but also specifically for UCLA and all those who have been more recently impacted by the devastating fires. So thank you so much.
Yes, thank you again so much.
Well, thank you for having me. It's great to see you.